Welcome to Healthy Habits. We are so glad you found us. Here at Healthy Habits, we are dedicated to helping you live your healthiest and happiest life. Our channel is all about sharing practical tips and advice for improving your nutrition, staying active, and maintaining a healthy lifestyle. Whether you're looking to lose weight, boost your energy levels, or just feel better overall, we've got you covered. Our team of experts will provide you with the latest research and recommendations for living a healthier life. So join us on this journey to better health and wellness. Subscribe to our channel and hit the notification bell to stay updated on all of our latest videos. We can't wait to share our healthy habits with you.
Simple ways to reverse erectile dysfunction. Erectile dysfunction is a common condition in which a man has difficulty achieving or maintaining an erection during sexual activity. The penis contains two chambers called the corpora cavernosa, which fill with blood during an erection. It occurs when there is a problem with the blood flow to the penis, the nerves that control the blood flow, or the hormones that regulate sexual function. Symptoms of ED include difficulty achieving or maintaining an erection, reduced sexual desire, and difficulty ejaculating. Erectile dysfunction, ED, can be caused by a variety of factors, both physical and psychological. Some common causes of ED include physical conditions. Many physical conditions can contribute to ED, such as diabetes, heart disease, obesity, high blood pressure, and high cholesterol. These conditions can affect blood flow to the penis and can also damage the nerves that control erections. Other physical conditions that can cause ED include injury to the penis, prostate, bladder, or pelvis, chronic illnesses such as kidney or liver disease, and certain medications. Neurological conditions. Certain neurological conditions, such as multiple sclerosis, Parkinson's disease, and spinal cord injuries, can affect the nerves that control erections. Hormonal imbalances. Hormonal imbalances, such as low testosterone levels, can also contribute to ED. Psychological factors. Psychological factors such as stress, anxiety, depression, and relationship problems can also contribute to ED. These factors can affect a man's ability to get and maintain an erection, and can also affect sexual desire. Lifestyle factors. Lifestyle factors such as smoking, excessive alcohol consumption, and certain recreational drugs can also contribute to ED by damaging blood vessels and affecting blood flow to the penis. In this video we are going to talk about ways we can reverse erectile dysfunction. Please note this video is for educational purposes. If you have any medical concerns, please talk to your doctor. One way is by increasing nitric oxide, NO, production in the body. Nitric oxide, NO, is a molecule that plays a crucial role in the process of achieving and maintaining an erection. When a man is sexually stimulated, his body releases nitric oxide into the blood vessels in the penis. This causes the blood vessels to relax and expand, allowing more blood to flow into the penis. This increased blood flow causes the penis to become erect. Most of the ED medicines use nitric oxide. Nitric oxide also regulates our stress hormone cortisol and helps to improve sleep. Stress is one of the common causes of erectile dysfunction. There are several natural ways to help increase nitric oxide, NO, production in the body, which can help to improve blood flow and help correct erectile dysfunction. Exercise. Regular physical activity can increase the production of nitric oxide by promoting blood flow and oxygenation throughout the body. L-arginine supplements. L-arginine is a precursor to nitric oxide and can be converted into nitric oxide in the body. Try deep breathing and mindfulness practices. Practices like yoga and meditation that focus on deep breathing may increase nitric oxide levels by relaxing the smooth muscles in the blood vessels and promoting blood flow. Try acupuncture. Acupuncture is an ancient Chinese medicine technique that involves stimulating certain points on the body with thin needles to balance the body's energy. Some studies have shown that acupuncture may improve ED by promoting blood flow and increasing nitric oxide production. We are also going to discuss foods that are high in nitrates. Nitrates are compounds that can help to increase nitric oxide, NO, production in the body. Some foods that are high in nitrates include beets and beetroot juice, dark leafy greens such as spinach and arugula, celery, radishes, carrots, and cabbage. Other foods that you can consider are garlic, meat, dark chocolate, citrus fruit, pomegranate, nuts, seeds and watermelon. Avoid foods that can cause inflammation. Foods that can cause inflammation such as processed foods, sugary foods, and foods high in saturated fat can damage the endothelial cells that produce nitric oxide. Getting enough quality sleep plays a crucial role in regulating hormones, reducing stress and improving erection. Also remember that some drugs can cause temporary erection problems. Talk to your doctor if you are taking any medicine and are experiencing any recent changes in your erection. It's important to note that ED can also be caused by a combination of these factors. If you suspect you have ED, it is important to talk to your healthcare provider to determine the cause and appropriate treatment.
Thank you for watching this video on healthy habits. We hope you found the information helpful and are motivated to make positive changes in your own health and wellness journey. Don't forget to subscribe to our channel and hit the notification bell to stay up to date on all of our latest videos. We post new content every week, so there's always something new and exciting to learn. If you have any questions or comments, feel free to leave them in the comments section below. We love hearing from our viewers and always do our best to respond to your comments. Thanks again for watching, and we'll see you in the next video.